All right, wonderful. So as I mentioned, this is the online MPH information session, specifically focusing on food, nutrition, and population health. And we're going to do some brief introductions. So my name is Elise Rudolph. I'm the Director of Online Recruitment and Admissions here with our online Masters in Public Health program. I use she, her pronouns. And the other person on this slide is my wonderful colleague, Stephanie Nguyen, who's our online education recruitment manager. And Stephanie wasn't able to join us tonight, but essentially myself and Stephanie, we make up your admissions team. We are here to support you throughout the application process as you learn more about our program, as you begin working on your application, submitting the application, any questions you have about that whole process. We are here to support you, help you put your best foot forward. So definitely take advantage of us. You can attend sessions like what we're hosting tonight. Stephanie does one-on-one advising appointments. So certainly feel free to reach out to us with any questions about the application process or the program. And I'm very excited to introduce our guest of honor this evening, Dr. Sarah Zuba. And Sarah is actually the program lead for our food, nutrition, and population health concentration. Her research interests include evaluation of interventions designed to improve micronutrient status in young children and women of reproductive age, and improving biochemical methods and tools used for nutritional assessment and micronutrient status and mineral absorption. Of course, Dr. Zuba also teaches a few classes in both the online MPH program and our on-campus Masters in Public Health program. So welcome, Sarah. We're so excited to have you here tonight to share more about food, nutrition, and population health.
Awesome. Thank you so much for that introduction. But I really feel like all of our participants are our guests of honor, not me. I'm excited to get to know all of you and tell you about our program. So as Elise was saying, I lead our food, nutrition, and population health concentration. I love this role that I have that's in addition to all my teaching and everything else that I do, because it really gives me a chance to get to know our students and, talk about all the things that I'm excited about with the future of population health and with public health nutrition. And so my background is in predominantly my research has been focused in maternal and young child nutrition. So I've worked on several studies where we're trying to prevent micronutrient deficiencies during pregnancy and those early first few years of life. And most of my work has been in low resource settings. So I've worked on studies in the Gambia and Ghana, and then have done some other work in sub-Saharan Africa, and then have done some projects here in the US as well. And like Elise says, I teach several of our kind of core nutrition courses within our program, and then also some of our I teach one undergrad class, which I also really love, that global nutrition class. In that class, I get a lot of students who are not public health majors, and so it's like their first experience in taking like a nutrition or a public health course. It's really pretty fun. Okay, I'll stop it there, but I'm happy to talk more about myself and the classes later on as we go through all of this.
Awesome. Well, thank you so much, Sarah. We're excited to hear more from you in just a moment. And we will be covering some of the basics about the program, as well as digging into the FNPH concentration, as we like to call it. So one of the first things we'll cover is our mission, vision, and values. We'll talk a little bit about the program design, what do the course schedules look like, what are the summer visit requirements, timelines, things like that. We'll go over the program fees and funding opportunities. We'll talk a little bit about admissions, and then we'll make time for Q&A. All right, so with that, I'm going to hand things back over to you, Sarah, to talk a little bit more about the mission and vision for food, nutrition, and population health.
Great. So I'm going to just read the first sentence of this mission and vision, and and then I'll talk a little bit more about our program. But I just want to read the first sentence because it's a good summary of kind of where we stand. So our food nutrition and population health program trains future leaders in food and nutrition practice, policy and research to identify emerging nutrition and food systems challenges and solutions and evaluate their impact. And so our program is really designed for systems level thinking. So thinking about how food and nutrition programming can fit into the larger ecosystem of population health and of public health. And then we also spend a lot of time talking about the existing federal and state level programs and policies that affect people both in the United States and globally related to food and nutrition. And our program is really designed to um, give you the tools to be able to work either as a policy advocate or a practitioner of public health nutrition. One thing that I do want to point out is that this is not a nutrition science, a master's in nutrition science. So we don't get into the details of the biochemistry of nutrition too much. We are mostly looking at you know, the individual and the population level aspects of nutrition.
Wonderful. And a little bit about our values. So, here with the online Masters in Public Health program, our values are service in community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. And Sarah, I just wanted to ask, being as you are someone who's been with the online MPH program, you are part of the leadership team of this program, you are faculty in this program, you really know our students well. I just wondered if you might be willing to share a little bit about your experience kind of with these values and how they show up in our program.
Yeah, one thing that I'm continually reminded of when I'm teaching in our online MPH program is just the wealth of knowledge and experience that all of our students are bringing to the program. So one thing that's really amazing about this program is that you're going to be having classmates from all over the US and all over the world, and each of you is coming into the program with a different history. So some of you maybe have already been working for 20 years in food and nutrition, or some of our students are, practicing medical doctors, some of them are teachers, dentists. There's just such a breadth of experience and knowledge that our students bring in, and that is one of my favorite things about this program is that there's such a feeling of community building and community learning where everybody is sharing their perspectives and their experiences, and it makes it such a amazing and deep learning experience. So I would say that's one of my favorite things is just everybody really shows up and really and shares is like very open and sharing about their kind of perspectives and experiences, which is really great.
Yeah, I love that. And we'll talk a little bit more about this later, but one of the ways I think that shows up really well is in during our summer visits and
Mhm.
how much the students are really, I think, learning from each other as well as, their coursework.
hmm Oh, I was gonna add one more thing,
Yes.
because I remembered that last bullet point about centering wellness. That's another thing that we really take very seriously within our program, as all of us who are teaching in this program recognize that our students are whole people. So many of you maybe are juggling work. You are parents who have young kids that you're trying to, that you're also taking care of. And then you're on top of all of your studies. And so we really recognize that, and we try and build, and that we try and build our coursework with that understanding. So, our classes, our courses are set up where everything is asynchronous, so you can work on it at your own time. But we also make sure that you have enough time and enough opportunities to get all of your work done. And all of us are very understanding, if you have a sick kid or something it comes up, we're willing to work with you 100%. So it's I was just telling Elise before we got on before you all joined us, I'm also a working mom, so I totally get it. I was having to threaten my children to not come knock on the door this evening. So yeah, we're all kind of part of this, going through this experience together, and we try to meet you where you're at.
Yeah, I love that. Thanks so much for sharing that, Sarah. And pivoting back into our FNPH concentration, we sort of wanted to share some of the different opportunities that folks have career-wise if they choose to pursue food nutrition and population health. So there are a lot of different things that you can do if you choose to focus in this area. The logos you see here on the screen are just some examples of where some of our students are currently working or where they got jobs after leaving the program. Sarah, is there anything else that stands out to you about career pathways for our FNPH students?
Yeah, I'll just say that a lot of our students, well, not a lot, but we have, I noticed that our students kind of fall into a few different buckets. So we have some students who really want to get into policy, and so we have several graduates who went on to work for, the Department of Public Health within their state, or we have this Nutrition Policy Institute. We've had several students kind of pathway into that program. So I do find that we have a number of students who are really interested in policy work. And then we also have a different bucket of students who tend to be more interested in practice. So students who are working, who end up graduating and going and working for WIC or SNAP programs, or doing working within their cities at the government level, implementing nutrition and food programming there. And then I would say there's a smaller bucket of people who end up going into industry. So doing something at a company where, an example I can give is we had a student who was working for like a big tech company, but she was responsible for their health and wellness programming. And so she used her master's in public health that she completed with us to kind of help, build out that company's health and wellness programming. So we do have, I would say that those are the three buckets, with food and nutrition policy and food and nutrition programming being the two bigger ones, and then a smaller bucket of people who get into industry.
Awesome. Thank you so much.
Yeah.
And I'm going to talk a little bit more about the program design. So, sort of what to expect from our online MPH program. So we would describe ourselves as being 90% online. And this is true if you're doing the food, nutrition, and population health concentration or any other concentration in the program. Essentially, what that means is the program is majority online, but we do have 2 required summer visits. We'll talk more about those in just a moment. But apart from those 2 summer visits, all of your coursework will be online and asynchronous. This is typically a 7-semester program or 27 months. And this is a professional MPH. So that's how we would describe this degree, as being a professional degree program. Now, something I will just give a caveat to is as it pertains to federal financial aid, we are currently not in the bucket of programs that are considered professional, but generally speaking, we are a professional degree program. Again, course delivery, everything is provided asynchronously. However, we do have weekly deadlines in the program. So even though you're able to access, the lectures, the course materials at any time that is convenient for you, you're not required to show up for synchronous Zoom sessions or things like that. There are, however, weekly deadlines. So we want to make sure that all of our students are able to stay in sync with the coursework, that you're meeting all of those weekly deadlines and not falling behind in the program generally. Most folks find that to be very helpful. And those deadlines are very consistent, like the times that you're discussion posts are due, your assignments are due. Those are typically like the same day each week.
Um,
So cool.
I'm going to
Oh,
jump in and just add one more thing while you're on that topic
please.
of the course delivery. So, one thing that we spend a lot of time thinking about and working towards within our program is, community building with our students, because that can be really challenging with an asynchronous, as Elise was saying, it's an asynchronous program, so you don't have any required live Zoom or live Zoom lectures or discussions. Myself and many of our other faculty do typically schedule optional weekly discussions, so there are opportunities to connect as a group. But one thing that wanted to add is that one of the reasons why we have those weekly deadlines is also that we can have these like robust, um, interactive discussions online. And so although you're not interacting with each other face to face, either in a classroom or through a Zoom meeting, we all of us instructors spend a lot of time developing our discussion boards and interacting with them and moderating them. And so there's a lot of really great conversations that happen through those discussion boards that happen on a weekly basis. So you and all your classmates are working on the same material at the same time and have the opportunity to kind of discuss it, not quite live, but you're kind of having this back and forth conversation, which is really cool.
Yeah, that's incredibly helpful. Thank you for adding that. And as you mentioned as well, faculty hold office hours, and while they're not required, folks do have opportunities for those synchronous sessions if they're interested in them. Um, so in terms of the course model, students typically take 6 units a semester. And the way our program works is at the beginning of the program, usually like in your first year, there are 6 assigned core or what we call breadth courses. So you're going to be taking those kind of core public health courses in your first year. And then in your second year, that's when you'll start weaving in your concentration specific coursework. So again, those 6 core courses at the beginning, all of the incoming MPH students will be taking those same courses. And then in your second year is when you could start doing your food, nutrition, and population health electives and things like that. We have, I would say, robust student support in this program. So it's something that we really value. We really, Sarah talked a little bit more about how much we care about wellness, flexibility, meeting your specific needs. Part of that is that every student is paired with a program manager, or you might be more familiar with this is like an academic advisor. So you'll have someone who is assigned to you based on your concentration, who is there to help you with degree planning, making sure that you're on track to graduate on time, all of those things. And then you'll also be paired with a faculty advisor. So essentially every student in this program will have 2 advisors who are available to them to support them throughout the program. On top of that, we have a number of other like resources that students can take advantage of, and we'll talk a bit more about that in a moment. Again, this is a part-time program, but it is fairly rigorous. So we tell folks to allot 15 to 17 hours a week to dedicate toward listening to the lectures or reading course materials, completing your assignments, etc. Typical course load is 6 units a semester or 2 classes a semester. And it's a total of 42 units completed over the course of those 7 semesters. We do have a capstone, so all MPH programs, accredited MPH programs have a capstone requirement. Our capstone is a comprehensive exam, but some folks get a little nervous when they hear that, but our faculty spend a lot of time making sure that you are prepped and ready, and that this comprehensive exam, truly feels like a review of things that you've covered and learned in the program. And then as an added bonus, it is an open book exam. Great. So I want to talk a little bit more about the summer visits. Again, we describe our program as being 90% online, so all online except for the 2 summers that you'll be enrolled in this program. So enrollment is continuous over the course of those 7 semesters, and that includes 2 summer sessions. As part of those summer sessions, students come to campus for 5 to 7 days usually, and we put on, I would describe it as a conference-like event for you. It's something that our faculty and staff look forward to all year long because we finally get to meet you face to face. It's also your opportunity to meet all of your cohort members in person. So we work really hard on this year round because we want to make it fun and an engaging experience. It includes some of your class sessions, which will happen in person. We build in some professional development sessions. We've done like conflict resolution, anti-racism trainings. We build in networking events, so opportunities to meet faculty or to network with alumni from the program. And we build in some social events as well so that you can get to know your cohort members better. And I wanted to ask Sarah, again, I know this is always a really fun time of year, but do you have any sort of highlights of the summer visit that you would want to share?
My favorite part of the summer visit is always the lunches that we all do together. So in your first year, we have like a larger group, a couple larger group lunches where faculty and staff and all the students get to have a chance to just kind of casually hang out and eat together and chat. And then in your second year visit, we do smaller group lunches. So often, typically, it's one faculty member and then maybe a group of 4 or 5, and we take you out to lunch. And I love those. Like, I really get a chance to meet the students, and like we have a chance to just really talk. And oftentimes, the conversation goes into a million different directions, and it's not just like a formal kind of informational interview or formal discussion. It gives me a chance to really get to know everyone. So that's my favorite part. But talking with the students, I oftentimes I hear them say that the summer visits are their favorite part of the program. It's just like such a wonderful community building opportunity, and it's these people that you've been interacting with. Um, for a year or 2 years online, because oftentimes you'll have the same people in your classes and in multiple classes. And so our students really create strong connections with each other. They have WhatsApp groups and, meetups, and they do all kinds of stuff outside of like the programming that we structure. And so it's really fun for them to like all get together. It's a really valuable experience, I think. And
Yeah.
that's just the fun stuff. That's not even like the amazing speakers that are organized to come and talk and the activities that there's like group work that is done during this time. So it really is a neat experience.
Yeah, thank you so much, Sarah. And I will definitely second this is often a highlight of the program for folks, and especially in the second year visit. This year, I know like a bunch of students got a big Airbnb together. They've been in each other's weddings, so I think there's some really incredible lasting bonds that are formed during these weeks. Um, yeah, so we'll talk a little bit about logistics now. So, what does it actually look like when you're in the program? Um, during your first 2 semesters, and this is regardless of whether you start in the fall or the spring term, your first 2 semesters, we want to give you some time to kind of adjust to being in school again, especially if you're working full time while going to school. And so your first 2 terms, you're going to have 2 classes that you're taking concurrently. So you'll be enrolled in 2 semester-long classes. These are both full term and you'll be taking them at the same time. And then after that, so beginning in your third term, you're going to start taking 2 consecutive classes. So one right after the other. These are 8-week courses as opposed to 16-week courses. And that's how you'll complete the rest of the program. There are opportunities to either shorten the duration of the program or extend it. As Sarah mentioned, we really value flexibility. We understand that sometimes things happen, that you need to take a semester off or you need to take more time in the to complete the program. And so we really do our best to work with you and accommodate whatever is going on in your life and the schedule that you need. So you can see the two examples. The second and third examples show first a abbreviated timeline. So if you wanted to complete the program sooner than in 7 semesters, the fastest you can complete the program is 6 terms. And that would require you to take some terms with 3 courses. And then you do have the option to extend the program for up to 5 years, I believe. So if obviously we want to support you completing the program, but again, if you need to take a semester break, you do have that option. And you can re-enroll after that break and extend the length of the program a little longer.
Yeah, I'll add that it's actually pretty common for people to extend the program. So as you can see from our schedule, that you really don't get any built-in breaks where you're kind of going fall, spring, summer for 2 years. And I would say a lot of not a I don't know how many I don't have the actual numbers I guess but I would say a measurable number of people often will take that like summer two class off so that they get a little bit of a summer break, especially people who have school age kids and that's their summer. So it's very common for people to end up taking half of a semester off or a whole semester off at some point during their program.
Yeah, absolutely. And again, your faculty advisor and your program manager are there to sort of meet with you and help you plan that out as needed. Awesome. Well, Sarah, would you like to take some time to talk a little bit more about FNPH curriculum specifically?
Yeah, definitely. So after you finish your breadth courses or your core courses, then you transition to completing your concentration specific requirements. And so for FNPH, we have there's five courses that you have to take. So the first two are kind of non-negotiable, and there's no opportunity to select other ones. That's our nutrition assessment course, and then our food and nutrition policies and programs course. And then we also have you have to take some human nutrition course. So there's two options. You can either take a maternal and child nutrition course, or you can take a diet and chronic disease course, which is has a little bit of coverage of maternal and child nutrition, but it's mostly based on adult health. Um, and then in addition to those 3 courses, the other two, you just have to select from a number of community health science courses that we have. And so there's a list of them here. And there's others that you can also choose from. And then in addition to those 5 concentration requirements, you also get to choose 3 electives. And those can be from any concentration within our program. And that is something that I would be working with you. So I'm the faculty advisor for the FNPH concentration. And so many of my meetings with students is talking through like, what are their career goals? What are the skills that they want to have when they leave this program? And so then figuring out which classes are the best fit for them to make sure that they're leaving the program with all of the skills and all of the tools that they want to have to be able to be strong candidates or, for their future careers, for their future jobs that they want to apply for. So, um, yeah, and so some students, they might be really interested in epi or biostats, and so they'll take their 3 electives within that concentration. Other people maybe are more interested in global health, and so they'll take their 3 electives. They'll take more of the global health courses, or they might be more interested in health policy. So there's a lot of different uh, options available to you.
Awesome. And one of the things that we want to highlight, so we've talked a little bit about some of the curricular support that you get through your faculty advisor and through your program manager or academic advisor. Um, but one of the other places within the program that our students get support is around career planning and practicum. We'll talk a bit more about what practicum means in just a moment, but I want to highlight our RISE office. So RISE is our career and leadership office. They support the School of Public Health, and we have dedicated members of that team who are committed to supporting specifically our online MPH students. They are there to, as a one-stop shop, essentially to support you with your practicum, career planning, and any leadership development. One really nice thing is that you have access to the RISE office even after you graduate. So not only are they there to help you, if you're looking to change jobs, while you're in the program, they can help you with resume building, interview prep, uh, job boards, things like that. They provide you with support while you're in the program, and then also after you've graduated. For the rest of your life, you can have access to this as an alumni of the program as well. And so our public health practicum is essentially part of this program. It's a practical or applied practice component of our online MPH program. Essentially, this is a 130-hour applied practice requirement. It's intended to provide professional experience. A lot of students use it as a way to kind of apply some of the things that they're learning in class into a real world situation. Many students also like this as a way to maybe get experience in another sector or another industry where they're maybe not working yet or where they'd like to be in the future. So essentially what we will do, that RISE office that I just introduced, they serve as your practicum consultant. And they have a really robust kind of platform. Sorry, that's the word I was looking for. Platform where they compile a lot of practicum opportunities. It's called Flex. So when you're looking for your practicum, some of our students choose to complete their practicum where they're already employed, or you can use the RISE tool Flex to look through different opportunities. And you can see here on the screen just some examples of places where students have completed their practicum in the past. Again, it's a great way to get applied practice, especially if you're looking to kind of pivot careers or pivot into a new sector or industry. Usually it takes folks about 3 to 4 months to complete their practicum. And our RISE team can also help you find a practicum that best suits your needs if you're looking for a remote position or hybrid, or if you're local to the Bay Area and you would like to do something in person, they can assist you with all of that and ensuring that you're staying on track to complete this requirement. All right, so I want to talk a little bit about cost of attendance. We know that paying for grad school is a huge part of the consideration and decision-making process. Currently, our tuition is $1,629 per unit. We are a 42-unit program in total. And again, usually folks are taking about 6 units per semester. There are some campus fees as well, and folks often ask, well, why are there campus fees if this is an online program? And so those campus fees go toward things that you still have access to as first and foremost a UC Berkeley student. So though you are an online MPH program student, first and foremost, you are a UC Berkeley student, and there are things that you have access to, like library services, counseling services, a lot of things that you can access remotely as a UC Berkeley student, even things like working with our financial aid office. So this Berkeley campus fee goes toward tapping into those campus resources that you still have access to as an online student. There's something called the Student Health Insurance Plan, or SHIP. This is able to be waived if you are currently employed and you have health insurance through your employer. The majority of our students do choose to waive SHIP, but if you would like to take advantage of the student health insurance plan, you can see it's around $4,000 for fall and spring semesters. There's a document management fee, an instructional resilience and enhancement fee that goes toward ensuring that we are keeping all of our online learning up to date, and providing you an engaging and accessible online learning experience. And that brings the total cost of the program to just around $75,000 if you are waiving SHIP, which again, the majority of our students do choose to waive SHIP. Now, how to fund the degree. So there are a variety of different pathways that our students take. Many students in the program are taking a combination of some of these pathways, and this is certainly not, there are certainly other options and avenues that you can explore as well, but these are some that we want to highlight. So one thing that's great about our program is that you are able to work full time while going to school. It's definitely what the majority of folks in the program are doing. And so for some, they are able to self-fund the program because they're working full time while going to school. If you are self-funding, you could consider signing up for a fee payment plan. And this breaks those semester tuition payments down into 5 monthly installments, which sometimes makes that the self-funding option a little more feasible. One thing to look into is federal student aid. We encourage everyone to complete FAFSA, even if you aren't sure that you want to take out student loans. It's great to just complete that application, see what you're eligible for, and consider if it's something that you would like to take advantage of. I definitely encourage folks to kind of explore some of the changing policies around federal financial aid, as some of those things will be changing as of July. Some of the requirements will be changing as of July 26th. So definitely look into that. But again, we encourage everyone to complete FAFSA. Work study. So if you do complete FAFSA and you are eligible for financial aid, some students have the opportunity to convert some of their student loans into work study. Public service loan forgiveness. Again, this is one of the things that does change with different administrations. So it's always best to check the PSLF website to see the most current opportunities. But we have had students who are employed by government or nonprofit agencies who were eligible for public service loan forgiveness. And in some cases, they'll even be eligible while they're in the program and actively going to school. Employer sponsorship, this is definitely one that we encourage everyone to explore. So check with your employer to see if they offer any tuition benefits. Sometimes you might need to ask an HR representative. It might not be totally clear in your benefits package if this is something available to you. So certainly worth checking on this. We have even had some students successfully request sponsorship from their employer, even if it wasn't like a guaranteed benefit that they have. So always worth asking. External funding. So highly encourage everyone to explore scholarships and fellowships. ASPPH is a great resource. They have a page where they compile public health specific scholarship opportunities. I personally always encourage folks to explore locally as well. See if your community offers any scholarships. There are sometimes like local nonprofit organizations or philanthropic organizations that focus specifically on higher ed in your area, or maybe fund based on certain affinity groups, things like that. So encourage you to check out local as well. And then internally to our program, we do offer the Dean's Health Equity and Leadership Award, which is a scholarship that covers the equivalent of 7 semester units, which comes out to around $11,000 in total. All right, so moving on to admissions. I want to make sure that we give Sarah some time to weigh in on this, so I'm going to try to run through the checklist fairly quickly. I will say if you have questions specific to the admissions checklist or the admissions process, definitely reach out to me or reach out to Stephanie and we can meet with you personally. But essentially, we are looking for some quantitative preparation in the program. So statistics with a college level, statistics or college level math passed with a B plus or higher. We do have a minimum of a 3.0 GPA, but don't let that discourage you. If you have less than a 3.0, it doesn't mean you shouldn't apply. Again, I would just connect with Stephanie or myself, and we can talk about other ways to make your application competitive. So we do use an advanced GPA calculation. When we send out the slides, you'll be able to click on the link and see more about that. We require 2 essays, a statement of purpose, and a personal history statement, 3 letters of recommendation. We do need to see transcripts from every institution you've attended, including, if you did community college and then transferred, a study abroad semester, all of those transcripts we do need to see. We want to see a resume or a CV showing your professional experience. There is an application fee, and if you completed your undergraduate degree in a country where English was not the primary language, then we may require an English proficiency exam as well, either TOEFL or IELTS. Some really good news is that we don't require the GRE, so you don't have to worry about that. But if you did take it, you're welcome to send it to us, and you'll see the code there. So Sarah, as someone who reads and evaluates applications every year, what would you highlight as, what do you think makes a strong applicant to our program?
So when I'm reviewing applications, one thing that I really look for that is important to include in your statement of purpose or your personal history statement is why this program specifically. So why is this program the best fit for you? Like what is it that is exciting about this program for you? Why are you pursuing your master's? What are your career goals? Why are you doing this now as opposed to, 10 years ago or 10 years in the future? So really providing that context of, like, why is this program the best fit for you? And then why are you pursuing your master's in public health? Those are 2 really important pieces. Another thing that I sometimes notice, uh, people could be you be really thoughtful about who you're asking for your letters of recommendation. The your letters the people who are writing your letters of recommendation can really help fill in some gaps in your application that maybe are not clear in other areas. So for instance, maybe if you don't have a strong statistics background or you haven't taken biostats or statistics in a long time, if you can ask for a letter of recommendation from somebody you work with, or maybe, somebody that you volunteered with, where you had a role that you were working with, you were doing some math, or you were working with numbers or working with data sets, and then they can talk about your quantitative expertise, then that would be great. Or for instance, if you're coming from a totally different industry. You've never taken a public health class. You've never taken a nutrition class. Um, you're not working in the field of public health or nutrition. Then it's really important to get a letter of recommendation from somebody who has seen you working in the community, has seen you doing public health related showing your public health passion, then that can be really important. So, um, uh, I would say those are 2 of the big things. Another thing about the GPA, I would say that the further you are from having completed your bachelor's, the less weight I put in the GPA. So if you have done a lot of, maybe you completed your undergraduate degree 20 years ago and you've been working this whole time, or you've been working, volunteering in your community long term with some organizations, then I look a lot more to all of that other those other experiences that you've had over your GPA. So, if the GPA does tend to be more important if you're somebody who has just graduated, just because you don't have as many of those professional or volunteer experiences to kind of show your preparation for this type of rigorous program. Um, I would say those are the big things. So yeah, the quant preparation, so having, showing me that you'll be able to succeed in the epi and biostats classes. The letters of recommendation, be really thoughtful about who you're asking and help and make sure that you're kind of giving a full picture of yourself. Sometimes again, I'll see students and they'll have three letters of recommendation from like three different biology teachers. And so I'm just getting that one piece of them, where I would recommend you're kind of getting letters of recommendation from people who can speak to different aspects of yourself. Um, yeah, and then why this program specifically. Those are my three big things.
Yeah, I think that's great advice. Thank you for that, Sarah. And again, Sarah definitely has reviewed a lot of applications
Yeah.
for this program, so she definitely knows best. Um, awesome. So we are currently accepting applications to the program. We're accepting applications for our fall 2026 cycle. Our priority deadline is January 5th, so just around the corner. I highly encourage folks to shoot for that. The fact that you're here tonight shows that you're on top of things and, definitely going to be, I think, preparing at least for that priority deadline. However, if you're not quite ready for the January 5th, our final deadline is March 2nd. And this would be to start the program in August of 2026. If you're sort of just starting your exploration and you're not totally sure yet, if you're ready to apply, we do also admit students in the spring, and that application deadline is August 2nd. So we want to make sure you all have our contact information. The online.mph at berkeley.edu is an email address for myself and Stephanie. We're here to answer any questions you have about the program. We also offer one-on-one advising, and we have some more information sessions coming up in December and in the new year. So definitely stay in touch with us. We want to be a resource to you. All right. Well, thank you for listening to our presentation. I'm going to stop the recording and then open things up for Q&A.